Thanks, Dr. Culver. I have a bit of a story I'll share with you right now about the topic of the empowered patient and things that everyone in this room can do to get involved in research and enabling that future that we want for sarcoidosis. I'm going to move quickly through some of this. I'm going to actually skip some because we've also been able to consolidate just about all the questions that had come in, and we'll have some expanded time at the end to cover some of those questions with Drs. Judson and Culver. Just sort of a requisite disclosure. I work for a pharmaceutical company, Pfizer. I'm also on the board of the foundation here, but the remarks I'm sharing really don't represent either of those. It represents really my own experience because I have pulmonary sarcoidosis myself. So in many ways, I look like many of you in this room, at least on the inside. Now, my path to a diagnosis, like many of you, involved a lot of tests, involved a lot of time to get to a diagnosis of, in my case, pulmonary sarcoidosis. But I learned afterward that there was sort of another diagnosis that I qualified for because I found that I was hungry for information, as were probably most of the people in this room, and that's why you're here now. And I found that I was meticulously trying to track every one of those tests that I was running off for, the PFTs, what are the numbers, the start and stop dates of all the different meds I was trying, the results of an MRI, a CAT scan, an X-ray. And I found that I was hungry for all the data itself. I didn't want to just be told the results. I wanted copies of all of it. And I wanted to have copies for myself, and I wanted to have a place to put it all, right? And then I found that I needed every paper that I could get my hands on, right? Because I didn't want to just hear about that there is some result out there. I wanted the paper that was written. And I found that when all of this came together, there was another diagnosis that I learned about. I was an EPatient. And I had never really heard this term before, and I kind of backed into it a bit, and some of you may have as well. But this idea that an EPatient is somebody, it doesn't mean that you're just online, right? It means that you're educated and you're engaged in your health. A lot of this is enabled by electronic tools, the fact that you have access to all of this information, but the outcome is that you're empowered. And you're empowered by the fact that you have access to all of this information. This picture here is a cancer survivor from up in New Hampshire named Dave DeBronkart, who's a strong advocate for all of us getting access to our health information. And when he was invited to speak and do grand rounds and present at a few medical conferences, he would open with that slide. Give me my damn data. I've got a few statistics I'm actually going to move quickly through. Over half of Americans are online, and it's the number 3 site. Facebook is the number 3 site for folks over age 65. That 59% of U.S. adults are online looking for health information. That a quarter of U.S. adults are online participating in health-related discussion forums and blogs. That 1 out of 5 U.S. adults have watched online videos through YouTube and other channels about improving their health and managing certain conditions. And finally, that 1 out of 5 of us are actively using many of these electronic tools available to self-tracking your PFTs, your exercise, your diet, and the other things that you want to self-track because you as an engaged patient want to understand what are the associations that are important to me? What are the triggers that work and happen in my life, be it related to stress or exercise or diet or the meds I may have started or stopped? And how do those match up against those PFTs? Or, as we were talking about earlier, just the more subjective assessment of how am I feeling today? Sort of the Ed Koch question, right? So what I wanted to talk for a few minutes about is less about what's out there in terms of information and more what are the things that we can do and that we can do today. And the first topic is around getting connected. There were a few questions that had come in about, through the index cards, about how do I get connected with support groups and get connected with others. And for many of the patients here that are patients at Sinai, most of you are probably familiar with what's probably one of the largest sarcoidosis support groups, certainly in the region, if not in the country, perhaps in the world. And so I would encourage you to take advantage of that support group locally, as well as others that are located perhaps closer to you at home if you've traveled a bit to come in today. And I understand there are quite a few that have traveled in, not just from New Jersey and Connecticut, but out in Virginia and from other places. If support groups in person don't necessarily work for you, there are support groups online. And one which is supported in part by the Foundation for Sarcoidosis Research is through a group called Inspire. And you'll find this online support group linked at the Stop Sarcoidosis website. There are almost 10,000 members of the sarcoidosis community at this one website. And you can see the demographic mix. They're mostly from the US, but it actually does represent right now about 75 countries. And in terms of activity, there have been almost 13,000 discussions around sarcoidosis posted here, with over 115,000 replies to those discussions since this was started just a few years ago. So tens of thousands of posts, a lot of those questions that you and I have had that were on those index cards, some of which are covered here. Now, I will throw out one caveat, right? This isn't a moderated discussion by the physicians that you've heard from today. This is moderated by you, the patients. This is what some people call crowdsourcing. So you will see things on here which are scientifically accurate, and you will see other things on here which might just work for one person in this room, but have no scientific data behind them. And that's where it gets a little tricky for all of us as educated and informed patients to try and make sense out of all the information that we hear about. We want to take the input from other patients. Most of us as patients value the input of other patients almost as much as the input from doctors, but we need to understand how to, from a medical literacy perspective, how to interpret some of those things that people may post online. I was pleased to hear a lot of head nodding around this idea of get your data, it's yours, right? It's legally, well, legally somebody could say it's not yours. Legally somebody could say it's technically owned by the provider who produced that medical record. However, just about all privacy laws ensure that you have access to that data. And in fact, the incentives that you may have read about in the news that were launched to help encourage providers to use electronic medical records, where there are several $billion allocated in stimulus money to help the uptake of electronic health records in doctors' offices and in hospitals. Well, one of the requirements of that is that you as patients do have access to that information electronically. So this is the not so distant future of no longer having to wait just for lots of paper to get photocopied or printed, but that future where your providers are capturing data electronically and you have access to that data electronically. But certainly in the near term, I encourage folks to feel empowered by getting access to their information. It improves your portability. If you wanted to go get another opinion from another provider, you have that data. And as I'll talk about in a moment, it enables some research as well. Some people ask, well, what am I going to do with all this data, right? And the answer is, to me, I don't know, right? It's yours. I don't know. I'm not a hoarder necessarily, but there are a lot of things that are mine that I just want, in my possession, and I'll figure out what to do with it later. But there are places to put it. This is an example of something called Microsoft Health Vault, which is free. It's a personal health record. You can create an account for free, and you can store your health records there. You could store it on your own computer. You could store it in a shoebox, but it's yours. One of the reasons I think that it's important to work towards this future of all of us having access and controlling our data is we're very excited in this country about that future of electronic health records and that future where we can actually improve healthcare and improve outcomes for patients because your data is electronic and it's more easily shared. But all of us have a lot of data that's scattered around about us right now. I've been a patient. I used to live in Boston, so I have data at Boston University Medical Center and Mass General. I have data here at Mount Sinai. I have data from my doctors out in New Jersey. I've got prescription data at Rite Aid and CVS. I've filled a prescription just about everywhere, right? We all have. So no one place, no one institution has that whole big picture about you except you. You are the best aggregator, the best hub, the best central point of all of the data and information that may be out there at all these places. The best place to aggregate that is each one of you, rather than relying on someplace else. And then when you go and you see a Dr. Culver, a Dr. Padilla, and so on, you have that big picture of information because you have all that data. It's not just one little fragment of data. And then you can enable that future of being able to share that data to improve research. The last note about feeling empowered is to get involved. And this is a screenshot of clinicaltrials.gov, which is hosted by the National Library of Medicine at the National Institutes of Health. And this is considered the definitive source in this country for finding clinical trials. If you're looking for a clinical trial in just about any disease, there are certain laws that require many studies to actually be registered here. And so I have to say, it's not considered the most user-friendly website. So there are challenges to using tools such as this. However, with some persistence, maybe some friends, you can find answers and you can find opportunities for yourself to participate in research. This is a statistic that comes from cancer, but it's very relevant here. Less than 5% of cancer patients participate in clinical trials. Cancer patients, right? You would think that that would be an area where you'd have some of the highest rates of involvement of any disease, and it's still less than 5%. And when you talk to patients, 3 out of 4 of them say, I'd participate if I knew about a clinical trial, but 3 out of 4 say that they have little information or knowledge. And this comes back to this topic of empowerment. You can get informed, and there are opportunities to learn more about research. And I would say that if less than 5% of cancer patients are participating in research, we don't even have that number when it comes to sarcoidosis. Why participate in research? A little over half of Americans say that they believe that health-related research has been important to them or somebody close to them. But meanwhile, 9 out of 10 of us are filling prescriptions for ourselves or loved ones. And the only way that those prescriptions made it into the pharmacy in the first place and made it available for your physicians to prescribe is because somebody before you participated in the research that was essential to understand if those medicines worked or not. So is health-related research important to you? If you're managing a disease, if you're taking a prescription medicine, I would say it certainly is. However, and this is sort of my last of these big statistics I'll throw up, 80% of clinical trials for new medicines are delayed because they can't find patients to participate. So it is a significant challenge. I'm going to I'll pause here just for a moment. Clinical trial participation is not for everybody, but there are many different types of research opportunities that are available. There are studies that are observational, meaning that there are studies just to try and understand the natural progression of the disease versus studies that involve an intervention like a new medicine. Now, there are pros and cons to participating in those kinds of studies. You can get access to new medicines before they're available to others. There's some tests that may be done at no cost. But as with anything, there are risks involved. And so it is an important balancing act for anybody to make sure that they are fully informed and aware before going down a path of participating in a clinical trial. A couple of other ways to get involved. FSR, in collaboration with the National Rare Diseases Biospecimen Resource, has a program enabling you to share tissues and other biosamples. Biosamples meaning any sample that comes from your body. And this doesn't mean that you need to wait for somebody to die and donate tissues. This is a way that you can do something today. So anytime you have a biopsy or you know of someone having a biopsy, there's an opportunity for that tissue to not go to waste, but to be able to be biobanked and stored at no cost to you so that future researchers can access that and better understand the disease. And when you see those slides like we did earlier of a microscopic sample, again, that was only there because somebody before us donated the tissue that was needed to enable that research. And finally, along the lines of getting involved, I have this slide here really for two thoughts. One is there are new registry initiatives. Registries are a very benign way to participate in research. Registries where you share information about yourself without necessarily having to identify yourself so that you can be counted. And that's important for so many reasons. At the very most basic level, when we're trying to advocate with our policymakers and our legislators, they don't know that you exist unless you're counted. They don't know that sarcoidosis exists unless we can say X number of patients in your district are affected by this. And so we need you to be counted in order for us to do that type of advocacy to get those dollars. And when those dollars can be gotten, they can be leveraged for things like this, which is a new grant that was made available through one of the centers at the NIH of upwards of $12 million for sarcoidosis and another highly unrelated condition. But why are they both here? Well, most people feel that they're both here lumped together, not because there's any clinical reason, but because people made noise. And when folks from those two organizations made noise, money became available to fund research. So we need to make sure that you're participating in research and that we're being counted. A few links, and I'll leave off here. With that, actually, I'll end this part of the session, and I think we'll have some time now to go after some of your questions. Thanks.